My name is Dylan Klempner. I'm an artist in residence at UF Health Shands Hospital in Gainesville, Florida. I met Cindy Craig in June 2014. She was in the hospital recovering from surgery and preparing to start chemotherapy treatments. Cindy can tell you her story from here.
On my 40th birthday in February 2014, a nagging pain in my right knee got worse. While my family doctor diagnosed me with arthritis, my cousin, Debbie, an oncology nurse, encouraged me to get an x-ray. Mom was also concerned. I thought they were both overreacting. To humor them, I got a second opinion. 25 years earlier, at the age of 15, I came home from school one day with an achy knee. After an x-ray, my doctor referred me to an orthopedist. When he saw my x-ray, his face fell. Mom knew what he was thinking. I had cancer. A surgeon at the Cleveland Clinic diagnosed osteogenic sarcoma, a low-grade cancer that would not require chemotherapy. After 2 surgeries and 10 years of follow-up appointments, my doctors considered me cured. I went on to earn 2 master's degrees in art therapy and library science. I traveled to Japan, Alaska, Ireland, and New York City, and I made art. In 2010, I was hired as the psychology and sociology librarian at the University of Florida and moved to Gainesville. By 2013, I had built up a record of professional achievements, published journal articles, and given presentations at national conferences. My mid-career review was very positive. Life was good. It is hard for me to describe the feeling of seeing that x-ray on the computer screen with a large fuzzy blob in the dark space where my old tumor had been. I told myself it was just scar tissue. When the doctor came in, I asked him what the blob was. He said he didn't know what it was, but immediately scheduled me for an MRI. A week after the MRI, I returned to the doctor's office with my cousin Debbie. The nurse handed me the MRI report and left. Debbie helped translate the diagnosis: recurrence of osteosarcoma. My doctor confirmed that my cancer had returned. In late April, I met with Dr. Spiegel at UF Health Shands Hospital. He was friendly and down to earth and seemed excited about my case. May 1st, May Day, was the day of my surgery. The surgery took 12 hours, much longer than my doctors had anticipated. The next morning, I felt as fragile as a baby bird. I was visited by a young, perky duo of occupational therapists. They instructed me to get up and walk to the sink. I felt dizzy and nauseated. I lay back down on the bed. The therapists decided to try again later. When they left, it was just my brother and me in the room. Tyler said, "You're dizzy because you're having a panic attack." In that moment, I could suddenly feel my emotions again. Despair washed over me as I began to sob. Tyler silently walked over to my bed and hugged me. My stomach ache disappeared. During my first stroll in the hallway, I looked up and saw a man standing by the nurse's station. He was holding a guitar. The physical therapist offered to send him to my room. The musician played and sang some Jim Croce songs for me and my family. He was the first artist in residence I met at Shands. During my first week of chemotherapy, Dylan brought me some painting supplies. We chatted while I painted a colorful image of my knee implant, which is called a megaprosthesis. After my surgery, some friends had suggested some nicknames, including the Bionic Woman or Cindy 2.0. I chose Mega Cindy because it sounded like a Japanese superhero. I used my art to personalize my hospital room. I displayed these paintings, other artwork I made with Dylan, and a photo collage of sexy men in kilts that my cousin made to cheer me up. Dylan would often visit and we'd chat about art and film. Even when I felt too weak to make art, I enjoyed our chats. Dylan made me feel like a peer rather than a patient. During one visit, Dylan mentioned that he had always wanted to film the beautiful view from 8 East, a time-lapse video of the clouds and sky. He asked me if I would like to collaborate on it. At first, I almost said no. Then I reconsidered, since I had little else to occupy my time. A few months into my treatment, I was starting to feel the negative effects of the chemotherapy. When I ate, it was strongly flavored junk food like Doritos and honeycomb cereal. I was fatigued and had developed migraines. After one difficult week in the hospital, Mom returned from Ohio to stay with me the remaining 2 months of my treatment. One morning, Dylan returned with the video camera and tripod. I centered the camera on 2 dormitory buildings on the UF campus. The next week, Dylan reviewed the footage I had captured. His enthusiasm encouraged me to continue. He trained me on the details of using the camera. Over the course of several weeks, I captured footage from 5 different hospital stays. Dylan kept asking me what we were going to title this video. Mom said we should call it Out the Damn Window, because it was painful for her to watch me going through long, boring chemo treatments while staring out my hospital room window. Some days I would get frustrated while struggling to set up the tripod and getting the white balance right. But at least I was frustrated about something besides my chemo for an hour. This project turned out to be ideal. I had lost interest in making any other art.
As a work of art, Out the Damn Window is not meant to be entertaining, though it is at times sublime. We believe that viewing the video can encourage empathy by asking viewers to share one woman's experience inside a cancer hospital. It also shows the potential for new media art in clinical settings. The video and its title reflects Cindy's ambivalence about the hours she spent gazing out the window of her hospital room. At the same time, those images of nurses caring for Cindy are among the most compassionate views inside a hospital that I have ever seen. They are not public relations photos, but spontaneously captured moments of genuine tenderness.